Hi, everyone. I'm Peggy Clark, and thanks for joining the second Aspen Health For All conversation. We launched this series to amplify the important work being done by leaders and innovators all over the world to address COVID-19. And right now we have two remarkable entrepreneurs who are dear friends who I admire very much, Kennedy Odede and Ahmed Kura, called Kura, from Kenya, who are really on the front lines addressing COVID in a really important way. So let me just start by situating us a little bit in terms of coronavirus and Africa. And as we all know, as coronavirus spreads across the globe, total cases are topping 3 million and more than 225,000 deaths. We all face a crisis that none of us could have imagined even just a few months ago. And the virus is bringing inequities into sharp relief. And we realize the most vulnerable everywhere, all over the world, are hardest hit by the pandemic. So far, the virus has largely been concentrated in the US and Europe, but we're waiting for the other shoe to drop when coronavirus hits Africa, where fragile health systems, a lack of healthcare workers, and weak healthcare facilities all lead to projections of anywhere from 300,000 to 3.3 million deaths. Imperial College London has estimated 300,000 deaths. The UN Economic Commission of Africa projects a worst case scenario of 3.3 million deaths in Africa. And Africa's cases have doubled in the last 2 weeks from less than 1,500 to 32,000 cases as of yesterday. Yet, Africa has been here before with Ebola, and in many ways is way ahead of the US and Europe in terms of prevention and preparation, even with low resources. African leaders have been working on scaling up community health workers, developing large-scale testing, all since late February. So the other element in Africa is, of course, concerns about more other diseases besides COVID, such as malaria and deaths from other diseases that will be impaired by the fact that everyone moves to COVID. So there's a lot of concerns about how the virus will hit Africa. And it really remains to be seen how and where it will roll out in the most serious ways. But one asset that Africa has to bring to this challenge that many other people don't have is its remarkable entrepreneurs. And so today we have two amazing leaders who have just jumped in, Kennedy and Kura, and we're going to have a little chance to talk with them about what they have been doing. So it's my pleasure to introduce them. Kennedy, hello.
Hi, thank you so much, Peggy, for this.
Thank you, Kennedy. Thank you so much. Maybe just move a little closer to the camera and speak a little louder. So many of you know Kennedy. He's one of Africa's best-known community organizers and social entrepreneurs. For 23 years, Kennedy lived in Kibera slum and experienced the realities of living in extreme poverty firsthand. He was the oldest of 8 children. He became a street child at the age of 10. Yet he still dreamed of changing the community. In 2004, he had a job in a factory earning $1 for 10 hours of work. He saved 20 cents, he bought a soccer ball, and he started Shining Hope for Communities, SHOFCO. Driven by this entrepreneurial spirit and innovation, he has completely transformed Kibera, which is one of the largest slums in the world. Although he was entirely informally educated, Kennedy received a full scholarship to Wesleyan University, where he became one of Kibera's first to receive an education from an American liberal arts institution. He graduated in 2012 as the commencement speaker and with honors. Since that time, Kennedy has received numerous awards. He is close friends with Bill Clinton, Chelsea Clinton, and Nicholas Kristof, who often features him in the New York Times. He was named to Forum's 30 Under 30 list in 2014. And he's a dear friend who is helping us all to rethink how we address community from community action. Welcome, Kennedy.
Thank you so much.
Great, I'm glad to hear from you. And then let me introduce our other wonderful panelist, Ahmed Kura Omar, who goes by Kura, is a native of northern Kenya, the very highest northernmost part of Kenya that borders with Ethiopia. And he's been working on sustainable community development for his whole life. He founded and ran the BOMA project, focusing on women's economic empowerment. And then he later started Kenya Drylands Education Fund for his own homeland in the far north. and his focus is on education standards and particularly for girls. He's building schools in hard to reach areas and takes a holistic approach, which also includes working on dry water harvesting. And he also has jumped in to prepare for COVID in a remarkable way. Welcome, Kura.
Thank you so much, Peggy, for having me.
Thank you so much, both of you. Let's start with you, Kennedy. You have such a remarkable life story, and I'm so moved to call you my friend, and it will do anything to support your work. But tell me a little bit about, in your own words, your life's journey and what motivates you to do the work you're doing right now in Kibera.
Thanks so much, Peggy. I think I lived in hardship and the struggle in the slums, and I did all the bad things, and I realized that I didn't have hope, and I was searching. And after reading a lot of books on the street, I came to believe that change comes from the community, from grassroots. So my dream was, how can I be part of change? And I really got tired of complaining. I'm living in a slum, don't have this, nobody care about us, and how do you become a doer? So my dream was, how can I be a light that can light in the middle of the slum, that can give hope to the people? And when people come together, they are powerful. So that really gave me a lot of hope to start Shofco, that if we come together in this slum of Kibera, we're gonna have big impact in the community. So I'm a strong believer of community ownership. When people come together, there is magic.
Beautiful, excellent, Kennedy. Thank you so much. And we're going to jump to what you've been doing right now in preparation for COVID. But let me jump to Kura. So Kura, you also have a remarkable life story, and it was almost just a luck that you got a sponsor and were able to go to university in the United States. And now, like Kennedy, you've returned home to help your people. So tell us a little bit about your own life story and what motivates you now.
Thank you, Peggy. I think amongst the pastoralist community, and was given the opportunity to study. And I did not have my parents, no mother, no father, dropped out of school, and I was kicked out. And in the streets, I got my brother-in-law who actually worked in the US, and he connected me with a sponsor, someone who gave me the opportunity to go to high school. And the question is, why amongst all the pastoralists was I given this opportunity? Why am I not the harder suffering with dust in the middle of the desert? Why is it that I was chosen to actually get this? And with that, how can I use the opportunity I'm given, and I was given by this individual, to get back home and change the life of my people? And if you hear about famine in Africa, if you hear about droughts in Africa, if you hear about diseases, if you hear about poverty, the first people they will talk about are the pastoralist communities all over Africa, but mostly in northern Kenya. And for many, many years, we were the face of a calamity. We talk about a problem, it's us that they're talking about. And I felt like I needed to do something. And with that, at the beginning, I started the Bowman Project to economically empower women. We have people who are the poorest in the country, but amongst them are women who have no rights at all. They are regarded as children, and they don't participate in economic empowerment. And how can we bring women to the platform so that they can actually help our community get out of the situation we are in? How can we make sure we are not dependent on the relief and are self-reliant? And with that, then later on, I started Kenya Drylands Education Fund because of the highest illiteracy rates of 80%. 80% of the people from where I come from have not gone to school and cannot read and write. And they have no jobs. They cannot take advantage of the opportunities in this country. And how can I bring them? And that, with the gift that I was given, I am giving it to them to make sure that this happens. Two friends who are supporting me.
Okay, thank you, Kura. Thank you so much. That's fantastic that you started that. So Kennedy, let's try to help us situate ourselves in Kibera, which is the most densely populated place certainly in Kenya and perhaps in Africa, and there are more than 1 million people live there. And you told me the other day that generally a family with 6 children can be living in a 10 by 10 room, and 50 people share one pit latrine. So it's easy to think about how when coronavirus hits, it will be deadly there. So you immediately jumped in and started doing hand washing stations. Tell us what you've been doing in Kibera slum right now and how much progress you've been able to make and what your plan is.
Thank you so much. So honestly, Peggy, when they talk about Corona, I hear many people say that it is an equalizer. It makes people equal. But let me be honest with you, not true. The rich are still rich. Those who live below $2 still live below $1. And even this disease, coronavirus, it makes things much worse for those who are poor. So I was really worried when this thing hit us on the ground with people who are living with bad sanitation. You know what I mean? Don't have enough toilets. For example, one pit latrine can be shared with more than 50 families, and children play together. There's no playing ground. So, and it's so sad because our life has been about togetherness. That feeling, that being around each other is how we survive. So what Corona did is to disturb our lifestyle. You know what I mean? And being unrealistic. So I immediately, when I hear what was happening in the Western world of social distancing, wash your hands with clean water, I was really in pain because I realized that this is what is working for Italy, for New York, for the people who have apartments and 2 to 3 bedroom. It's very easy. You stock your fridge, you can survive for a couple of weeks. But what about my neighbors where I used to live in the informal settlement? This is going to be a disaster. So the first thing we did is that we have what's called Shofco Urban Network, a network of community, women group, youth group. We talked on a WhatsApp group and we said that what they need was the basic need. The first thing was to put hand washing stations in the main entrance of the slums. So you don't have to complain. You go there on a Shofco tent, you wash your hand. And then the second thing we did is that we realized that people don't have even water to drink. They struggle. So you have to make water available. We start hiring trucks with water to pass what we call last mile, you know, where you can't reach, you know what I mean, to give them clean water. And it's not the time to complain or to talk about the government, you know. It's a time that what can you do? As my mother used to say that if a snake bites you, you see the snake, you use the stick, that whatever you have, you beat the snake with. So Corona is that snake. So, and then I went back to what I believe in. What is my strength? I believe in people. I believe in community. So first of all, these people don't believe in government. I'm sorry to say that, because of the social they live in. So therefore, there's a lot of theories, myths about Corona. Corona is made by the government to get money, which is not true, you know? Again, Corona is a disease for the white people. Again, Corona is a disease for people like Kennedy, the Odede, who traveled to America. So when they saw me like Kennedy, you are the one who can have Corona, not us. So you have to change their way of thinking. And to do that, it's not about TV, it's not about what the government says, no. It's about going down to the community for them to have the ownership and telling them, can we really afford ventilators? Can we really afford the ICU machine? When this thing hits you, the rich gonna survive because you can't afford it. And then religious leaders, community organizers, people start feeling it. You start seeing your neighbor, community health workers, talking about Corona. So it was very powerful. That's what we did, not to scare people, but to make them own it. I swear to you, if they don't own it, they won't care. So right now we have put almost over 300 hand washing stations. We have over 20 trucks carrying water and telling them to do what's called physical distancing, but it's hard. But Peggy, honestly, what they really need, truth be told, is that they told me this, and it's a fact. We don't care about Corona. We care about starvation. And that's a very powerful message. So that's still something that if they can have basic need, they can take care of themselves. But how do you take care of yourself if you don't have food? Right now, truth be told, in Kenya, economy has been really hit hard. These people who come where I work and where I grew up, they used to work through what we call hand to mouth. No much saving. They live in 10 by 10, 6 children there. It's tough. Those jobs no longer there. So now, even you're gonna struggle for food before the virus. So that's what I see. So I realize that basic need is what is really most required. Yeah.
So Kennedy, let me just ask one question, and it's incredible that you've already put up, 30,000 hand washing stations, and there's wonderful videos and film clips of both Kennedy's work and Kura's work that I'll on www.shofco, shofco.org for any of our listeners that want to watch them. It's kind of wonderful to see what's been able to be done there. But how are you going to address the food crisis? Do you have plans for that? What are you thinking about this issue of the hunger challenge that you also see ahead?
So this will be a bigger thing. So first of all, I met the Minister of Health and we discussed about it. And I told them that they need to think in terms of cash transfer.
Can you speak up just a little bit, Kennedy? Okay.
So when I met the Minister of Health, Mutai Kagwe, we discussed about it. And I told him that it would be good if the government can come up with a cash transfer. Our government don't have enough money, truth be told. So, but what we're doing now, for example, there's a company called Jumia, whereby they are good in online. So we partner together with them to give food to the communities. So I have a crazy big idea of raising $5 million that's gonna support 3 million people in the informal settlement in Kenya. That means to ensure that our washing stations continue, to ensure that we give even cash transfer to some, and to ensure that those who can also get food through the network that we're doing. So yeah, I think it's possible. And we also been getting support from Kenyans, which is I've been so impressed, and private sector, because right now is not a time to think about sustainability. I see it for me is more like a war, it's emergency. How can we save life?
Yeah.
If we give these communities basic needs, believe me, they will handle protections. They have food. They'll be like, okay, we can try to wear a mask in the community. They'll do it. I'll be really so impressed to see how they're taking their own effect. And then we also have to believe in these people. We have to talk to them as human beings. They are not stupid. They care. But I saw people running for food. And I thought about even to myself, Kennedy. If I was living in Kibera now, I'm being honest, if I live in Kibera, and for the past 3 days, I didn't eat anything, and people are telling me something called coronavirus, and I see food, I will run for food before I think of coronavirus, I'm being honest. But now, because I can have food, I'm thinking mostly about corona,
Yeah.
So we just need to find ways on how to support these people in the communities.
Beautiful. Thank you, Kennedy. Thank you so much. And Kura, let's turn to you. So the drylands region where you're working is one of the most drought stricken in the world. And in many ways, you're in the polar opposite of Kennedy. You're working with the highest levels of malnutrition, highest levels of poverty, but people are very remote and water is a huge challenge, but still you're preparing for COVID. So tell us what you're doing to prepare for COVID there.
So Peggy, when you are in a situation where 80% of the people are living below the poverty line on less than $1 a day, when you are in a situation where the healthcare system is not even just broken, it's actually not there. You will walk probably 40 miles to get to a health center to get a service. When the government tells you that we need to close the livestock market, and that is our only source of livelihood, and all our markets are completely shut now. We are in a situation where we know, because even with the little calamity, northern Kenya gets affected really much. With this, where Nairobi is crying, where the whole world is bleeding and is on its knees, we know that we are going to be wiped off. And for me, my community have told me about a pandemic that happened around 1920. Where an entire village was wiped and only 2 people remained. They know these things and they know the effects and they're worried. And should we be waiting for it to happen to us? Our best strategy is to make sure that we maintain hygiene. We actually have discipline. We only go shopping when we have to. We need to make sure that we control who comes into our villages. So I work in an area that is 72,000 square kilometers. and 8 people per square kilometer, really sparsely populated. But no water, no health services, no access to government, no strategies at all. And with that, we had a small funding that was directed towards water and sanitation and health that we asked our donor Vibrant Village to help us direct into putting together strategies. We believe in community participation. So we started a community consultation process. It's called community conversation, to come up with strategies on how we can make sure that, how we can actually control and make sure this does not get to us. Because we realized that with no water, we needed to have water supplied. So our donor last year gave us a truck, actually donated a truck to us to supply water. And we started supplying water to these communities because the government of Kenya came up with curfews that, you know, you can now be walking past 7 p.m. The pastoralists will walk almost all night taking care of their livestock. Now they have to stay indoors. It gets really hard for them. And with that, we did 350 hand washing stations. I come from a community of free souls. They don't believe in these restrictions. They don't believe, they say, how can this thing be controlled with just washing your hands? And they don't get it. So but with training and using community health volunteers, we actually managed to get to 7,000 households. We use peer systems, we use radio, and we don't have a lot of funding. We may not be looking, you know, like funding we needed that Kennedy needs, for instance. We did so little, but we can get to so many. And with that, we are already planning to get to 20,000 households. And we are asking and talking to our donors and friends to support us. And with that, we have community health volunteers who have actually given their time to come and work with us and do this. And we are currently actually leading. But most people call us. Even today, I receive calls from communities who are in distress, who cannot access water, who feel like the other town actually are prepared. We are not prepared. So we have masks in place. We have sanitizers. I applied Kennedy, by the way, to Kenya Pipeline Corporation, and they gave us 4,800. You should do that too. They gave us 4,800 sanitizers. It's not enough, but at least it gets to the people.
It's a start. Yeah, that's wonderful, Cora. That's incredible what you've been able to do. And let me tell everyone that you can see video clips and help to support Cora's Kenya Drylands Trust at www.kdef.org. You can also go to our website at the end to find out more about how to help. But I want to talk to something. I think, you know, I'm so moved, both Kennedy and Cora, about how at the core of your being, you really believe in this notion of community trust and the power of communities to act. And one of the things we are seeing so much in the COVID pandemic is that the places, the countries, and the communities that are able to get through this are ones where there's community cohesion and where there's high levels of trust. And you, Kennedy, have said many times, you don't think change is possible without communities really owning the change themselves. So let me ask you both, and let me start with you, Kennedy. How do you inspire and nurture community action, and how will that help to address COVID?
Yes. So as I saw you did a little bit of comparison with the West. I feel like, to be told, I think the West have lost the value of community, a little bit of it. I think, I don't know if you become richer, you forgot it. People don't know their neighbors. So for me, I love our community so much. This idea that I know my barber shop, I know my neighbor. If they don't open my 10 by 10 room at night, they'll come and check, is Kennedy okay? You've not been opening this door. You know, so I wanna cry. That's the thing that really gives me joy. So then the question here is, how do you plug into that? Okay, because already there is this idea of Ubuntu in my community, in whereby they really know each other. They care about each other. In my community, and the same as Kura's community, a child is for everybody. So when they saw Kennedy doing something bad, any neighbor will be like, no, you're my child. You know what I mean? So then you use that one as a way that we love each other. We better protect each other. So I believe nobody in Kibera or Dar es Salaam or in Kisumu want to pass a virus to another neighbor. I swear to you. So when they understand what is this virus, And they're going to use that idea of believing that change comes from them. So this is a good question for you, Peggy. The idea is that Shofco was there for them. Shofco was founded because of poverty, because of struggle. And we have been with them during thick and thin. So already there's a trust. Mm-hmm. This is a grassroots movement founded by our own son, Kennedy, as one of the founders. So when I speak to them, they see that this is somebody who cares about us. Shofco is our thing. And Peggy, I feel there's something I want to share with you quickly. I also feel we cannot let the government out. We cannot leave the government at this time. Why? Government don't live with us in the community. We are the one now to go to them. Like today, we had a big event with the government whereby we are bringing in community health workers to go door to door to find out the needs of the people in the slum. You know what I mean? So at this moment, I tell my community, let's teach the government. Yeah. Let's show them how we can have change. And let's show them the solution that they need to know. You know what I mean? So everything I'm sharing with you is coming from them, and we have to pass it to the government, because I believe the government may have a good intention, but they don't understand anything in Islam. So it's upon people like us to share with them that. So first of all is that community trust Shofco, because Shofco was founded when I was 15 years old boy with a soccer ball after working in a factory, and I brought in women and girls in the community, and I told them the story of Dr. King, that if we come together, whoever's wear the shoes knows where it pinches. That's from my mom's quote. Somebody called Dr. King was able to unite people in the US to fight for right. You know, so if we come together in this slum of Kibera, we can have a positive impact. You know, so that was the first of the trust. And now we have to bring this trust. How do we also work with the government to make this thing become a system change? But for Corona, it's something that everyone has something to offer.
Beautiful. Thank you, Kennedy. So we have lots of questions and answers coming in, and I want to turn to those because we only have a little bit of time left together today. And I need to tell Kura and Kennedy both that a lot of these questions are saying, two very inspiring men. We love them. We love you. How can we help? So I want to thank all of the listeners for saying that. But one interesting question here is this question about quarantine, that in a lot of the strategies are about quarantine and people staying inside. But the question says, it seems like a lot of areas in Africa are adopting quarantine strategies that don't make sense given the lack of resources to hunker down with. How do we strike a better balance? Kura and Kennedy, you want to jump in on that one in terms of if people do need to stay in their homes, how they can survive there?
So yeah, that's a good point. So for example, we also have to give credit to Africa as a continent. They have done a good job comparing to developed countries. If you think about this, I think what happened is that Africa was able to jump in quickly and bringing things that are really now working. But in places like slums or informal settlement, it's tough. Why? So this is my strategy. I told the government that Shofco has a health clinic. Shofco has a school for girls. We have a strategy. If the government work with us and we do what we are planning to do called mass testing in Kibera, we're going to isolate people who found to be positive. Because first of all, I talk about trust. They say a story in Kibera which is scary. They say that in China, I don't know if it's true or false, I don't believe it. They say in China, they were killing people. They take you away if you're positive. And I say, no. So they were scared that even in Kenya, it will happen like that. So I told the government that, listen, if you come into the community like Kibera and say, okay, we're going to work with Shofco. Shofco has a 5-story building. Those who are going to be found, we're going to put them in this place where there is beds. We put beds and we give them food, and their family will know where they are. But I don't think you can just take anybody from their house and take them somewhere they don't know. That will not work. Yeah. We also have churches in the slum, okay? We can also turn these churches and mosques to isolation centers. So I think it's possible if we do it in a community way.
Right. Okay, let me turn to Kura. Kura, you've talked about how even though in the very rural areas where you're working, there's people are still in clusters, they're not isolated. So how will you do social distancing and quarantine in the drylands region?
Number one, I think just being sparsely populated, we are somehow socially distanced. But we live in terms of clans. So we have about 60 to about 200 households settled in one area and with their livestock, and they will move from time to time. So ours is to, number one, bring in information. The government has already made it clear that from 7 p.m. you actually do not leave your area. We, together with community health volunteers and the chiefs, local chiefs, local leaders, have gone from one village to another with a PS system, trying to share all this information with them. It's something that they don't believe in. They don't believe in that this will be able to control, this can actually control the disease or the virus from coming to Marsabit County. As we speak right now, just today, there was one case in Wajir County, which is a neighboring county to us. That clearly sends the message that if we devolve testing centers, then we can find many cases. Okay. So Wajir County, as a county, decided to put up their own testing center, invested in testing equipment, and with that, they found out that one person had coronavirus. This is like the neighboring county to us. It could be with us already. And the idea is to lock down some of these counties to make sure that there is no movement here and there. But what can we do to make sure that we mitigate issues like hunger, and that we can provide for these individuals, and that we can provide water? If you don't want people to be moving beyond their time to look for their livelihood, what is it that we can do? It's getting really hard, especially for the pastoralists. Right. So we found for the men and the warriors, it's much easier because they are out there with the livestock. And they leave the women back home. The women will have to go for shopping and supplies from the main center, and with that they get contact with people. So it's something that is completely stressing us, and we are working with local leaders to put together measures in place to ensure that we have a discipline within our own villages, and not, just like Kennedy said, not avoiding the government. We're not going to reinvent the wheel. We have to take advantage of the systems that are already there. But our goal is to make sure we push this as far as possible away from us.
Yeah, I appreciate that, Kura. And Kennedy, I know that you're a part of the government's commission and task force on COVID. So thank you for being a voice for the communities that are going to be hit hardest with that. And I know you have a lot of confidence. And, in many ways, I think a number of African governments will show the way about how to do things like mass testing and stuff in ways that we have really, frankly, failed in the US. So we're coming to the end of our time, and there's so many beautiful questions over here. And I want to make sure that everyone can be directed to Kennedy and Kura's websites to get more information and to support them in their work, which is really just beginning. And just another small comment that I want to make about Kennedy and Kura, many people say crises make leaders, and a leader is someone that just jumps in, no matter what. As you said, Kennedy, if it's a snake or if it's whatever it is, to do whatever needs to be done. And so I really want to applaud you for that and thank you for your heroism. Also, just simply to say, I think I forgot to say it before, both Kennedy and Kura are Aspen New Voices Fellows. It's a magnificent program of the Aspen Institute, and part of our objective is for us to be able to learn from you. So we've certainly been able to do that today. Let me just say that you can support Kennedy's Shining Hope for Communities at www.shofco.org and Kura's Kenya Drylands Trust at www.kdef.org. And if you go to aspenglobalinnovators.org, which is our website at Aspen, you can find articles about Kennedy and Kura's work, video clips, and linkages to their programs to figure out how to help. I want to make sure that we close in the right way, and I just want to thank you both for what you're doing, Kennedy and Kura. And I don't know if you have any last words for the audience before we close off today's talk.
Thanks. I think so much. I will say that we have been hit with a crisis, but there's a time that everyone can show leadership in one way or another, and everyone can do something to save life. Thank you.
Thank you.
Thanks, Kennedy. We
Last
speak,
word.
actually, you're speaking my mind in the same language, singing my song. Peggy, humanity will prevail. And this is our biggest opportunity to actually demonstrate that in the middle of a crisis, we can all rise up to help the weakest among us. We can hold hands and actually win this together.
Yeah, beautiful. Thank you, Cora. And everyone, we hope you'll tune in next Thursday again for another conversation of Aspen Health for All. Thank you so much, Kennedy and Cora. We're with you. Thank you for your great work.
Thank you so much.
One.